Welcome back. This is the Web Station for Physician video training series, and this video covers the use of documentation in Paragon. Once you've selected your patient, which is discussed on how to do in a previous video, you simply click on the Documentation tab. Once documentation opens, you will see whatever is highlighted in orange is where you are in the system in this tab. Right now we're on Documents. Below all the documents listed here would be all the documents that have been completed for this patient in Paragon, regardless of their visit ID. There are different statuses of documents, and you can see the breakdown here. The very first one that you see at the top is a final signed note. You'll see that with a white with a blue checkbox. That means that the attending physician has signed this note, and this note is complete. Co-signed preliminary means that an advanced practice provider, such as a nurse practitioner, physician's assistant, intern, resident, or scribe, has completed this note and sent it to the attending physician requesting co-signature. Another option you see down through here is preliminary. Preliminary means that this note has been opened and started, but is not complete and nobody has signed the note. And then the very last one you'll see down here is called final with addendum. Final with addendum means that the note has been complete, it has been final signed, and then somebody has gone back and added an addendum to the note. If you want to view any of these documents, you simply can click on them. It will launch the document. The important thing to remember is that you can read any document, but when you're completely finished viewing the document and or you can print it, there's a print icon right here, then you have to make sure that you close the document. A lot of times you cannot get back to the census tab to view other patients in the system if you have documentation open. So when you're done, you simply click that and it will close the document. To create a document in Paragon, you go to the next tab over, which is Search Note Templates. You will find, depending on what rotation or practice you are in the hospital, there are several different types of documents. You can search for however you choose to search. If you hit the green arrow and or select Enter, it will give you the options for your search. When you find the one that you want, then you simply click on it to open it and launch the note to start the note. If you use this document a bunch, you can add these things to your favorite documents, and then you can just simply come over here once you see it in the search and click the blue flag, and that will add it to your favorite documents. Let's say we wanted to complete a hospitalist consultation note. I would simply click on it to open it. You don't have to address this because we have coders and billers that do this, so just hit no. And now the document will open. Almost every Paragon document we have in the system is set up very similar. There are a few customized documents, but not very many. You will see when the note opens, you have all the options on the left here. If you choose to go to a certain part of the note, you can simply click it and it will take you there. And if not, you can simply start typing in the boxes to fill in your fields. Almost everything is a circle strike through or a checkbox. There are lots of things in Paragon that will pull over automatically. Your full problems list, as long as you filled out your problems and procedures list at the top, right here. Then that will pull into your documentation automatically as long as that's complete. Home medications will pull in from the patient profile. So will immunizations, tobacco, alcohol, recreational drug use, family history. Vitals will report the last 24 hours. These are the latest set. And then your physical exam, you can come through and check box all of that kind of stuff. With your lab will pull in automatically with the exception of anything that's non-numeric. So if it's greater than 500, less than 50 as the actual result, you'll want to copy and paste using Control-C and Control-V on your keyboard to make sure that those things get into your documentation. There's inpatient medications. They will pull forward automatically if anything's been reported. Your plan of care, this is also where you can update your problems and procedures. If you just click, it will take you to the problems and procedures list and you can edit it, add things, and then save when you're finished. Assessment and plan are free text boxes. And then when you're finished, if you are an advanced practice provider, a resident or rounding nurse, and or intern or fellow, you would have an option to sign this line right here. It would say click here to sign. You would click, It would pop up and ask you who's your attending physician. You would select the appropriate attending physician and hit OK, and then that document would go to them requesting co-signature. If you're an attending physician in the system, then you will sign directly on this line by clicking here. It'll put your initials in there. It'll ask you then if you want to fax this document to anybody. You can choose to fax it by finding the provider in this list. Once you find them, you just hit OK and it will fax to that provider. If the patient has a PCP already listed for this visit, then those documents will go automatically and you may not get that prompt. If you decide that you want to fax that document later to somebody else, you can open the note once it's complete, and then in the bottom middle there's a button that says click to fax. You simply click that button, find your provider, and hit OK, and the system will go ahead and fax that document for you. When you're finished with the document, like I said, you can close the document when you're finished. If you had started a note and it was in preliminary, you would click on it to open it. If there have been new labs and things reported that needed to be brought back into this document at this point, since you've created it, you would want to make sure that you hit the refresh up here to refresh your data. And then you would have a save button here on your left. When you're finished again, hit close. And that takes you back to the documentation screen. Favorite note templates, again, I said if you're searching for your note templates and you find those things that you want to flag and add to your favorites, you can do that. So instead of coming into the search feature, then you can just come to your favorite note templates and find your document and start it from there so that you don't have to search every single time. A few other things I wanted to mention about documentation. The first thing is you have the option of if you want to merge multiple document types together to create one continuous note, you can do that. Let's say that my patient came into ER with chest pain. Here's the chest pain note. And let's say I started filling out the note, I went in and saw the patient, then the patient all of a sudden decided they wanted to leave AMA. So what I can do is I can hit this Merge Additional Templates button right here. I can find the one for AMA discharge. Click on it. And then that will merge this two together with my note. So when I get down through here, I can see once this note ends, they've put both of these things together. Then once I'm done with it, I can save it and close it. And then it will actually tell you here, you had the chest pain note merged with the AMA discharge note. Sometimes that's a handy feature. And the very last thing that you should note is if for some reason you started a document and this was not the correct document that you wanted, you also have the option to invalidate the document and get rid of it. So if you come up here to the top right, there's this little button here with a gray folder with an X through. If you click that, it'll ask you why you're invalidating it, and then you simply click OK, and then that note will go away. It will not become part of the permanent medical record, but it will always stay in Paragon. If you choose to view those documents, if you hit the Show Invalidated Documents box up here on the right, put a checkbox there, and you will see that these notes were created but were invalidated for whatever reason. So they're there as part of the Paragon record, but not part of the permanent medical final record. And that concludes the WebStation video for documentation. Thanks for watching.